Hi everyone, my name is Dr. Michael Clark. I'm an oral maxillofacial surgeon in Mission Viejo, California. I currently work in a partnership at Same Day Smile Designs with Dr. Ashkan Haeri. So I chose to be an oral surgeon by default. When I was a child growing up, there was a book. It was called All About Me. And on the page where it asked me what I wanted to be when I grew up, I wrote with a backwards D, dentist. I carried that with me, throughout my high school, whatever, thinking this is what I needed to be. But all the while I was training to be a dentist, I realized I needed to do something more than just dentistry. So I realized that oral surgery might be the way to go. So I put all my effort into making sure I could finish dental school, the top of my class, so that I could then have the option to go to oral surgery. During my residency, we would be on call, staying overnight at the hospital, and there was a trauma call, and we had to go and assess the situation. And it turns out the patient had broken jaw, some broken facial bones, and they were uncomfortable, they were in pain, and under the supervision at the time of my chief resident, we were able to fix the jaw bones, get them secured and safe, and make the patient feel better and more comfortable. We got to see them in follow-up and see that they were now eating food again, and I don't know, maybe if we weren't there, that wouldn't happen. What I do now and today is really a total difference than the way I started. Now I think it's evolved to the point where, my relationship with Dr. Ash and Same Day Smile Designs, we're able to have a higher calling. We can make a big difference in people's lives immediately. My mission statement for myself is really just centered about emitting care, caring for patients, caring for the office and the staff, making sure everyone around me knows that's the most important thing. We can sit and create fancy treatment plans, we can do fancy surgeries. Other people can do that too. But in the end, the person providing those services and care has to care, because entering into larger procedures, it requires a relationship between the provider and the patient and even the staff. Collectively, we form a family and we care. And it doesn't get old seeing people happy and smiling.